Hi doctor, how are you?
Hello.
So to start off, could you explain to us what is tuberculosis in simple terms? Is it still a serious health issue for today?
So tuberculosis is an infectious disease that is caused by Mycobacterium tuberculosis. Now, this is a bacteria that is commonly affects the lung, but it can also affect other organs such as the bone, the joints, the lymph nodes, even the brain for that matter. Now, tuberculosis, if we take WHO statistics, there's about 10 million cases diagnosed every year, and out of this 10 million, at least 1 million deaths yearly. So the mortality is quite high. Tuberculosis in Malaysia remains primarily, I would say, a common or a growing infectious disease that needs to be addressed, and it's been around for a long time, but with surges up and down over the recent years.
How do people get TB, and is it easily spread?
Okay. So tuberculosis basically spreads through the air. So when a person has active tuberculosis in the lung and is not treated, when the person speaks or laughs or coughs, then the bacteria is released into the air, and when someone inhales it, they can get tuberculosis. So the risk for a person to get tuberculosis is when they have prolonged close contact with a person. Example, a family member has tuberculosis. So the close family who stays with that person and has prolonged exposure to the person, then yes, they have a higher chance of getting tuberculosis. There are certain groups of patients who also can get tuberculosis. For example, patients with low immunity, patients who have got cancer, patients who have got HIV infection, any state that immunocompromise them. Some patients take medications to suppress their immune system. Those patients are more vulnerable. Now, of course, TB can also occur in the elderly patients as well. And then among household contacts of those who have positive smear positive TB that means patients who have active smear positive TB, the family members are at higher risk to get TB as well.
Okay, the next question. What are the common signs or symptoms of TB, and are they early symptoms that people that don't notice?
Okay, so tuberculosis actually is a disease that it has many signs and symptoms. So the commonest would be coughing. Okay, so a person who has coughed more than 2 weeks, that they should be suspicious or they should go and get it checked out. The other common symptom can be cough with blood stained sputum. So that's another worrying symptom that should be checked. Fever, unexplained, prolonged that too for about 2 weeks or so. Weight loss is another common symptom. Poor appetite, just no appetite to eat, even their favorite food for that matter. And in some patients, they start feeling very fatigued or tired over time. And if you also ask some patients, they may have night sweats, so they get this drenching sweat at night. So these are some of the common symptoms that patients can experience. I feel for a patient, if they have any symptoms, any of these symptoms that I mentioned, get it checked with a healthcare professional. More so if you have unexplained cough and fever for 2 weeks. These are one of the most commonest signs. You need to check it. And if you have any history, or you get news that recently a family member, a close family member, or a close friend, or even a colleague at the workplace has been diagnosed with TB, and you start showing some symptoms, it's worth checking it out. And if you are in close contact with this person who has been diagnosed with TB, even if you're asymptomatic, no harm checking it out.
Okay, doctor. So when someone should see doctor for TB screening?
Okay, so in a person who has unexplained weight loss, fever, prolonged, especially about 2 weeks, cough for 2 weeks, or coughing out blood, okay, these patients actually should go and seek treatment for screening. So for screening of TB, it is there are simple tests to do. Number one, if you have sputum, the doctor will ask you to produce the sputum. That sputum sample will be run for culture and sensitivity for AFP smear. That is to smear to see whether there is the bacteria in your sputum. And then they can also do further tests on the sputum to check for resistance towards medication. Okay, now we have something called Gene Expert, so they can even check it for resistance towards rifampicin, for example. So these are tests from the sputum. But there's also tests like X-ray. The doctor can order an X-ray and then they can see whether the lung is affected. Of course, all this will be done after the doctor examines the patient, gets a good history, and then does a thorough clinical examination. So all these are simple things that can be done by the doctor, and this can give you answers. Only if these don't reveal the answers, the doctors will then suggest or maybe a CT scan and work up a different workup. Okay, so there's also a condition called latent TB. This is when the patient has the bacteria in their body, but they do not have clinical signs and symptoms to suggest TB infection. So usually a person who has a close contact with a family member or colleague or a close friend who has had TB, they can go for screening, and they will be screened using a tuberculin skin test, or in some centers they may do a test called IGRA, it's a blood test. So using this, then they can tell you, whether you have got latent TB or not, because latent TB is also treatable, okay, and it's different treatment from TB infection itself.
Okay, Doctor, before we end our session, based on TB cases arising in Malaysia, do you have any message or advice about TB awareness and early testing?
Okay, so TB is curable. Okay, TB is curable, and the most important thing is you must take proper treatment. Okay, the treatment for TB is 6 months in duration. That's the minimum. In some cases they may prolong it, but in most cases it is 6 months. So if the medication is taken properly, it is curable and the patient can recover fully. Right now, early testing is very essential. It saves lives and it also reduces the risk of transmitting it to others. Okay, so early testing. So when you have symptoms, or if you are suspicious that you have been in contact with someone with tuberculosis, get yourself tested. Testing is simple. It can just be simple blood test or a tuberculin skin test, or it can just be producing sputum or an X-ray for that matter, but early testing can save life. If you diagnose it early, it's treatable and curable, right? Other than that, if a person is diagnosed with tuberculosis, completing the treatment is essential, because when you complete treatment, the risk of recurrence or the risk of this TB becoming resistant to treatment becomes very minimal or nil. So whenever a person is started on TB treatment, they must complete the full course and achieve cure. That way we reduce the risk of resistant TB, and we also reduce the risk of transmitting resistant TB to others. So take home message, TB is curable. Get yourself tested early and stop the transmission of tuberculosis.
Okay, thank you, Doctor, for your time and your sharing about TB. See you guys in the next episode.